Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the dermal capillary puncture. When you finish this chapter, you will be able to explain why the dermal capillary puncture is used instead of the routine vein puncture for the some patients. Select an appropriate site for dermal puncture and identify the equipment needed. Carry out the procedure for performing a dermal puncture. Apply the procedure for collecting a capillary specimen. NAACLS competencies describe and demonstrate the step in the preparations of a puncture site, list the effect of the tourniquet, hand squeezing and heating pad on the specimen collected by venipuncture and the capillary puncture, describe and perform the correct procedure for capillary collection method, describe the limitation and precautions of the alternate collection site for the venipuncture and capillary puncture. List the steps necessary to perform a venipuncture and capillary dermal puncture in order. Demonstrate a successful capillary puncture following standard operating procedures. Key terms are the intestinal fluid, palmar, plantar, dermal capillary puncture. Preferred method for the young patient, infants, very small children. May also be used for the other patients, obese, elderly, severely burned. Preparing for the dermal puncture. Dermal puncture preparations first is acquire and examine the requisition slip, greet and identify the patient, explain the procedure, verifying any dietary restrictions, wash your hands, put on the gloves. Put on gloves and selecting a dermal puncture site. There are the plantar surface and the puncture sites. Assembling dermal puncture equipments A, B, C, D and E. Planning and the dermal punctures, examine the fingers, choose a finger for the puncture and plane to cut across the fingertip, white area. Next, performing the puncture, clean the site with alcohol, allow it to dry completely, hold the finger to stretch the skin tightly and puncture the finger. Collection the capillary specimen, wipe away first drop, second apply the steady pressure and collect the specimen. Next is the complications of the dermal punctures, infections, osteochondritis, osteomyelitis, and there is the minimum and maximum blood volume. Collecting the correct volume is important enough for the test to be performed. Do not exceed maximum allowed for day or over short term. Most containers are the marked with acceptable minimum and maximum fill level. After the dermal puncture, place use the lancet in sharps container level the micro containers, check patient finger and apply bandages if necessary. Collect and dispose of the supplies appropriately. Thank and dismiss the patient, remove the gloves, transport the specimen to the laboratory. That is the chapter summary. Capillary dermal puncture is used for the collect blood sample infants, small children and adults in whom veins may be difficult to find such as elderly patients, obese patients or severely burned patients. And properly identify the patients and prepare from them for the blood collections by explaining the procedure and positioning them in a supported seater or laying position. Select an age appropriate site on the finger or the heel of the foot. In today's class I discuss about the capillary puncture. Thank you for watching.